Julia. Now, that health pass being introduced as of today, but this is against the backdrop of what the government has announced as a fourth wave of the pandemic, a spike in the number of infections, but just a slight increase in hospitalizations for now. Tell us more.
Exactly, James. So there's been a spike in the number of new cases. You said it, 18,000, more than 18,000 new cases in the last 24 hours, and is spreading in several regions across France, including in and around Paris. According to the health minister, this is a fourth epidemic wave, and it's affecting more younger people who are developing symptoms in the long run. Now, hospitalization have increased, but only slightly so far, and we're still waiting to see if this is a direct impact of the Delta variant, which is spreading, because there's always a 2-week lag between the number of new cases and the number of hospitalizations, or if it's whether perhaps younger people have not been as vaccinated as an age category. But the sanitary health pass is being analyzed by the government as we speak. It could be voted into law very shortly. And as you said, as of today, fully vaccinated people in France will be able to go back to museums and theaters, for instance, but not vaccinated people will be able to go, but they'll have to wear their mask and they'll have to show a negative PCR test. Now, this rollout is quite chaotic because, indeed, local authorities have been given a little bit of leeway to decide on whether to impose new restrictions depending on the situation locally. And just to give you an example, some theaters, for instance, have decided to, alternate between days where vaccinated people can go and other days where non-vaccinated people can go, but wearing masks. There's also the problem that, for instance, vaccinated people don't have to isolate anymore if they've been in touch with someone who's been infected. But what happens if they live with someone who is not infected? Those are just some of the many questions that the government has to answer as it's rolling out this sanitary pass.